All right, let's go ahead and get started with our program. My name is Joanne Byron, and I'm with the American Institute of Healthcare Compliance, or AIHC. We're a nonprofit licensing certification partner with CMS, the Centers for Medicare and Medicaid. And if you are new to compliance, or if you're not familiar with the DOJ or the Department of Justice, evaluation of corporate compliance programs, also known as the ECCP, then I'm hoping to share some insights on recent changes that have been made to this document and how this information can be beneficial to your compliance efforts. But before we begin, the information presented today and any discussions that we have, it's for educational purposes and not intended as legal or consulting advice. Compliance is very customized to your organization, to your size, the type of healthcare practice that you have. There's different rules and regulations for different types of healthcare organizations. If you are concerned about any compliance issues, make sure that your organization retains an experienced consultant or attorney to help you through those issues. Now, I'm sure you're wondering why I'm qualified to speak on this topic. I'm not an attorney and I'm not a physician, but I have been a compliance officer, started my healthcare career in nursing before working as a coder and then becoming director of reimbursement for a large healthcare system. I worked as a hospital employed consultant, helped with practice startups, as well as merging practices before becoming employed by a CPA firm as director of acquisitions and mergers. My focus there was to do compliance audits, to audit for laboratory compliance, OSHA compliance, corporate compliance, compliance with documentation, coding, and billing. It was part of the due diligence process that the hospitals retained us for so that they knew what kind of risk they were assuming if they purchased the practice and employed the doctors. I've also ran my own consulting firm from 1999 to 2020, where I performed internal investigations, audits, and performed government audits. I've served as an expert witness in several legal cases, and today I'm going to speak from my experience. And also thank you for spending time with me today to talk about the importance of compliance. I want to run through the agenda. We're going to talk about the background of the ECCP, what it is, when it was first published, and why. I want to go over some of the very basics for those of you who are new to the DOJ's ECCP, so we all start on the same footing. Then we're going to talk about how prosecutors are directed by the DOJ on what to look for, what questions to ask when they're conducting an investigation of a corporation, any corporation, and specifically that applies to us as healthcare corporations. Then we're going to talk about recent updates and new technology risks and DOJ's compliance expectations of us as healthcare organizations when we start to implement emerging technologies. Okay, does your organization reference the ECCP as a compliance resource? So I'm going to give you a moment so that you can go ahead and answer yes, no, or heck, I have no clue. I'm not sure. You might not be in a position where that type of information would be available to you. Corporate compliance, we usually have a compliance committee for larger organizations. The board of directors and the C-suite executives are heavily involved. But on a management level, managers and supervisors often are also responsible for specific aspects of compliance. All righty. I'm going to end the poll and share the results. Okay, so about 25% said yes, 14% no, and 61% just not sure. The evaluation of corporate compliance programs will also be referred to as, quote, the guidance during today's presentation. It was first published in February of 2017, and it's gone through several revisions since then, such as in 2020 and again in March of 2023, and more recently, September 23rd of 2024. Now, the guidance reinforces the criminal division's expectations that compliance personnel access and leverage compliance relevant data for monitoring and assessment, and it clarifies the criminal division's expectations regarding resourcing. The latest 2024 revision reflects the Department of Justice's evolving expectations in respect to corporate compliance programs, including how those programs appropriately address the compliance risks of new technology, such as artificial intelligence. This document is meant to assist prosecutors in making informed decisions as to whether and to what extent the corporation's compliance program was effective at the time of the offense and is effective at the time of a charging decision or resolution. And it's for the purposes of determining the appropriate form of any resolution or prosecution, and two, monetary penalties if there are any, and compliance obligations contained in any corporate criminal resolution. This is an emphasis from me to you. If you have documentation of the policies and procedures that you're supposed to follow, aspects of the corporate compliance program that you are responsible to execute. When things change, archive and keep older versions, because if you do come under investigation, they may be investigating you today for something, some suspicion or allegation that happened in previous years. And you want to be able to produce what was going on and how you were conducting business at the time of the allegations. So don't get rid of things, don't shred things, don't delete them. Make sure that you keep copies of everything as updates are made. Because the government gets a good return on their healthcare fraud and abuse control program investment, the government's going to continue to fund these investigations and prosecutions. And as it shows on the slide here, the Office of the Inspector General of the OIG, their healthcare fraud and abuse program for fiscal year 2023, they don't have anything out for 2024 yet. The return on investment over the last 3 years is $2.80 for every dollar that they expended. So they're getting a pretty good return. And as long as they're doing that, they're not going to stop. And they shouldn't, because the type of cases that they prosecute and go after usually are costing the government programs and us as taxpayers millions of dollars. Now, in 2023, the government exceeded 1.8 billion, B as in billion, and as in prior years, the reported settlements and judgments include matters the U.S. or the United States pursued, as well as matters pursued by relators or whistleblowers under the qui tam provisions of the False Claims Act, or the FCA. Now, because of these efforts, as well as those of preceding years, more than $3.4 billion was returned to the federal government or private persons. And of the $3.4 billion, the Medicare trust funds received transfers. Some of the adjustments, settlements, and administrative actions that occurred in fiscal year 2023 will result in transfers in future years. Polling question number 2. Does your organization use the OIG, GCPG, alphabet soup, the General Compliance Program guidance? Those compliance guidances, the individual ones and the general one, plus the ECCP, are great tools to help you build a solid foundation for your program. So if you know the answer to this, if you can tell us, yes, you do use the OIG's guidance, and prior to November, they had individual guidances depending on the type of healthcare provider you were. And that's how we taught our corporate compliance program. And now it's been updated for over a year ago to meet the expectations of the newer general compliance program. So 65% said yes, you do use the OIG as the basis for your program. So that's great. For the 3% that said no, it is a good idea if you go to oig.hhs.gov and look under compliance, and there's a whole page that gives wonderful information in regards to that, and just compare what the OIG is expecting to what you're actually doing to fill in any gaps, do a gap analysis. Okay, and one more polling question, then I'll leave you alone. You can relax and just listen. Does anyone in your audit or compliance department review the monthly updates to the OIG work plan? The OIG work plan, they have archived, they have recently added, you can research different things, but the OIG's program integrity and oversight activities adhere to professional standards that are established by the Government Accountability Office, or the GAO, Department of Justice, and the Inspector General community. Now, the OIG conducts nationwide audits, investigations, and evaluations, and they post new items that they're going to be working on and investigating to the work plan. So if you know they've just added something and you're a nursing home, or if you're a hospital, or if you're an FQHC and they post something new, a new investigation that they're going to embark on, and it could affect your facility, you want to know about it. They post new items monthly. So yes, 63% say you do take a look at the work plan. For those 13% that said no, you might want to look into it. It could be something very helpful to help you fine-tune your program, especially if you know the government is going to be investigating or auditing certain things. Those could be topics of conversation with your auditors and your lead auditor to be conducting investigations to make sure that you're on track. The ECCP makes reference to sections within something called the Justice Manual. It'll say JM, and it'll refer to a section of the Justice Manual. Now, this Justice Manual contains internal department guidance that has been adopted through a policy development process. I want to show you, let's take a look at one of the ECCP references to the Justice Manual. Okay, let's take a look at some of the wording in section 9-28.300, which states, the principles of federal prosecution of business organizations in the Justice Manual. It describes specific factors that prosecutors should consider in conducting an investigation of a corporation, determining whether to bring charges, and negotiating plea or other arrangements or agreements. Now, these factors include the adequacy and effectiveness of the corporation's compliance program at the time of the offense, as we had talked about earlier, as well as at the time of charging decisions. The corporation's remedial efforts to implement an adequate and effective corporate compliance program or to improve an existing one. Now, the 2024 revised guidance reflects increased expectations and sophistication around the use of data. For example, the guidance asks if companies are appropriately leveraging data analytic tools to create efficiencies in compliance operations and measure the effectiveness of components of compliance programs. The criminal division also added questions focusing on the quality of a company's compliance relevant data. For example, citing concepts that are familiar in the context of technology assisted review, the guidance asks how a company manages the quality of its data resources and how a company measures the accuracy, precision, or recall of any data analytic models that it's using. The key update to the ECCP recognizes that new technologies, such as AI, can pose both risks and opportunities for companies in their business and compliance operations. Now, the Department of Justice now expects companies to conduct risk assessments regarding the use of new and emerging technologies and to take appropriate steps to mitigate any risks associated with those technologies, such as ChatGPT, utilizing AI for documentation purposes, and so forth. Another reason to be concerned is related to the increasing integration of artificial intelligence into daily business practices. The Department of Justice has new expectations regarding the risk mitigation in this area. And if they did do an investigation, would your organization meet expectations? This slide is taken from page 2 of the 2024 EECP under Section A, Risk Assessment. The starting point for a prosecutor is to determine if your organization has been able to identify, assess, and define a risk profile for the purpose of mitigating the company's risk. The prosecutors will look to see if your program has been updated to address new emerging risks and if your plan has evolved over time. So be sure to keep previous versions of your compliance plan easily accessible just in case you need to produce such information. Also, you have to take a look at HIPAA security issues that surround any new emerging technology. Is it secure? Is it secure by design, which means that security is integrated and built into it by the developer? The revisions to the ECCP also call on companies to monitor and test their technologies to evaluate whether they are functioning as intended and consistent with the company's code of conduct and other policies and procedures. We have different blog articles and videos that we've done on building a culture of an ethical culture for conduct. It's very important that the company's code of conduct be from a top-down approach. There's no sense in saying you have to be compliant, you need to follow our policies, don't circumvent the system. We are going to be doing auditing and monitoring to make sure that things are running as we intended, and if not, we can take some corrective action and get things fixed. If we need to, we may need to self-report. But it's very important to know that upper echelons, the directors, managers, C-suite executives are walking the walk and talking the talk, because your frontline workforce staff, they're going to know if you really mean it or if it's just lip service, and that you're expected as a workforce member to adhere to these standards, but you see nobody else does that's above you. So it's going to blow up in your face. They will, during an investigation, talk to frontline people. They will get to the bottom of what's really going on. So it can't just be documented or in a computer, on your website, on the intranet. They are going to compare what the expectations are in writing compared to what's really happening. And that's why having an auditing for compliance program in place that's functioning is so valuable. Now, in a new subsection in the 2024 EECP, prosecutors are directed to ask questions, such as those listed on this slide and the next slide. The ECCP references the Justice Manual 928-800 and states prosecutors may credit the quality and effectiveness of a risk-based compliance program that devotes appropriate attention and resources to high-risk transactions, even if it fails to prevent an infraction. Everybody knows you can do everything right and still something can go wrong. But you have to show that you're making good faith effort. And those good faith efforts should be documented. Training and education is one of those very important things. Now, prosecutors are directed to determine if the organization has indication of something called risk tailoring, revisions to corporate compliance programs in light of lessons learned. Now, I don't know if all of you saw today's American Institute's News Blast. We put out news blasts about OCR and HIPAA infractions, the DOJ and OIG cases and different things. We publish those and kind of select different things for you to use as lessons learned. Learn what went wrong in other companies, how they got caught, what the consequences were. Learn from those, use those at board meetings, at management meetings, and say, we have got to do whatever we can to be better. We can learn from other people's mistakes. Let's not make the same mistakes. Okay. Some of the things that are on this slide is how the company is mitigating the potential for deliberate or reckless misuse of technology, which could include company insiders. And to the extent that you might be using AI or something similar, are controls in place to monitor and ensure its trustworthiness and its reliability? And do controls exist so that this technology is being used only for its intended purposes and not being used for something that could cause fraud and abuse? What baseline of human decision-making is used to assess AI? AI is new. It requires a tremendous amount of data to be processed for it to learn. And there needs to be human intervention all along the way. Do you have that documented? And how is accountability over the use of AI monitored and enforced? And how does the company train its employees on the use of these emerging technologies such as AI? The DOJ expects that a well-designed compliance program utilizes policies and procedures to give both content and effect to ethical norms and to mitigate risks identified by the company as part of its risk assessment process. Now, prosecutors, they're going to examine whether your company has a code of conduct. They're going to ask for it. They're going to want to see it evolved. How does your workforce know what the code of conduct is? Is it demonstrated that the organization has a commitment to full compliance with relevant federal laws? The ECCP has checklists outlined, such as on this slide, and it's throughout the entire ECCP. We can't go through the entire document in just 1 hour. So I picked and chose different things to use as a demonstration for today's webinar. But on this one, they are going to look, how was it designed? Is it comprehensive? Is it accessible? Is there responsibility for operational integration? And who are the gatekeepers? Now, under the topic of design, we'll take from the previous slide each item and go into a little bit more depth. These are the questions prosecutors are prompted to explore during an investigation. They want to know your process for designing and implementing new policy, how policies and procedures are updated to reflect lessons learned, and in light of new emerging risks related to new technologies. Also, keep minutes of meetings and attendance so you can provide who's been involved in all of this and how you've consulted appropriate departments before implementation. Comprehensiveness was also on the checklist. Now, for comprehensiveness of your policies and procedures, make sure to document company efforts to monitor and implement a wide scope which addresses the spectrum of risks related to regulatory compliance with the use of new technology. What I recommend, and we teach this a little bit in our Auditing for Compliance course, the healthcare failure modes and effect analysis. Root cause analysis is also taught heavily in our Auditing for Compliance course. Root cause analysis is required by hospitals and most healthcare institutions after there's been an incident. Healthcare failure modes and effect analysis is something that the Veterans Administration developed, and it's something where you're doing it ahead of time. So you're going to implement something new. What possibly could go wrong? And you build into the policies and procedures, actions and activities and training to minimize the risk of rolling something new out. So those are the types of documentations that they want to see. Accessibility. These are questions prosecutors are going to ask, and it relates to how available your policies and procedures are to appropriate parties within your organization and also to contractors, whether they are here or abroad. So how are you communicating to the relevant employees and to third parties? If you have foreign subsidiaries, if you are using offshore medical billing or an offshore cybersecurity company, what are the linguistic or other barriers for foreign employees' access? And have the policies and procedures been published in a searchable format for easy reference? And are they kept updated? That's what I find. Things are not updated timely. How does the company confirm that employees know how to access these relevant policies? And does the company track access to various policies and procedures to understand what policies are attracting more attention from relevant employees? That you can do electronically through thumbprints as you go through the intranet. Responsibility for operational integration. This is integrating your policies and procedures that typically lie with the top of the organization. To be effective, it should start with the board of directors, C-suite executives, and then it lands squarely on your organization's compliance officers' shoulders as well. You need to review the role of directors and top officials to see if accountability is listed. And of course, this is an important aspect of the compliance officer's job description. Compliance officers need to be out of the line of management, so they can't be influenced to look the other way or make exceptions for anyone in the organization. I also want to just mention, I have been a compliance officer as a consultant for smaller organizations during a transitional period till they could hire a corporate compliance officer. If you are contracting for the service, the government really expects you to have somebody who can routinely come on site and inspect and see what's going on compared to what's just written. You don't want somebody offshore or somebody in California who's the compliance officer for a large company in Cleveland. You need to be involved. You need to be able to talk to workforce members to find out what's really happening and to be able to do virtual. You can do virtual meetings and things, but they expect you to come and actually see what's going on within the healthcare organization and how healthcare is being delivered. And is it being delivered in a compliant manner? Gatekeepers. Evaluating this function is a matter of reviewing the required training of those within your organization that's responsible for and in control of processes. So, do they know what misconduct looks like? Do they know when and how to escalate concerns? Those are important parts of the training that prosecutors are going to look for. You can't just say, we've anointed Joanne to be gatekeeper. Well, they're going to say, okay, gatekeeper Joanne, tell us. And they're going to ask very specific questions related to the matter at hand. And if Joanne can't respond appropriately, they're going to see right through that. Whistleblowers, Quiton cases, relators. The updated ECCP includes questions to evaluate whether companies are encouraging employees to speak up and report misconduct. The DOJ will closely consider a company's commitment to anti-retaliation against whistleblowers by reviewing a company's policies, communications, and training, specifically with respect to speaking up and anti-retaliation. The DOJ will also assess any actions that a company takes against whistleblowers and will take appropriate steps to penalize or prosecute companies that retaliate against these individuals. The updated ECCP also expands on the concept of learning from a company's own misconduct, as well as the misconduct of others, and updating a company's compliance program accordingly. Have it on record that you are on the list serve for the American Institute of Healthcare Compliance, that you get news blasts, that you forward these news blasts as a compliance or manager to appropriate people on your workforce. Say, hey, are we checking to make sure that we're not making the same mistakes? The DOJ expects that companies track and incorporate into their periodic risk assessment lessons learned from their own prior issues and from other companies operating in the same industry and or geographical region. Reading our newsletters and monitoring new cases published on the OIG enforcement webpage are ways to stay informed of how other companies have been investigated and prosecuted. A couple of new questions were added to the ECCP under the risk-based and integrated processes of third-party relationships, such as evaluating if your third-party management process allows timely review of vendors, and if you are leveraging available data to evaluate vendor risk. This is very important when it comes to partnering with someone. You want to make sure that nothing would violate the anti-kickback statute or the Stark law, the self-referral law. Things have changed and get updated occasionally. It's good to have a healthcare attorney familiar with these rules and regulations to review partnerships and referral patterns and so forth. That is one way to show that you are taking action to review relationships that you have and referral patterns. Now, the DOJ puts forth the expectation of companies to perform something called due diligence. I talked to you a little bit at the beginning of our session that I did due diligence auditing for with a CPA firm. I was an employed in acquisitions and mergers. And this was during the time where hospitals were buying up solo and small group practices to absorb them into their physician networks that they were building and to employ the physicians. Doing due diligence can't be stressed enough. You need to make sure that whoever is involved that you're engaging with to review the company that you are looking at merging or acquiring has the requisite experience so that they know what to look for. I will share an example with you. I went into a practice that was being considered for acquisition. And it was here somewhere in the United States. I don't want to say exactly where. The revenue was tremendous, and it was a solo practice. The hospital was very interested in acquiring this practice, but I kind of scratched my head to look to see how one doctor could generate this much revenue for the specialty that he was. So I made an appointment and I wanted to meet with the doctor and the office manager. I showed up and the doctor wasn't there. The office manager goes, "I can answer any questions that you have." I said, "Well, I'm going to start by reviewing how you make appointments. And then I want to ask you who sees the new patients. And then we're going, after we get through all of the review of how you schedule patients and how often the doctor is in, I want to take a look at some revenue reports. And then I want to look, you have a moderately complex lab. I want to look to make sure that you are compliant in your lab. And then I want to audit some documentation against some claims." So I was there for a good day. But right away she said, "Okay, well, the doctor's only here 2 days a week." And I said, "Well, how can he see so many patients? Is he here for 12 or 15 hours? "Oh, no, 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 that's what I'm here for. I'm the office manager. I'm a certified medical assistant. I see all the new patients." And I said, "You do?" And she goes, "Yes. And I bill 99204 or 99205, depending on how many lab requests I put through, how many lab tests that we perform, and x-rays and radiology." And then the doctor looks at everything and the patient comes back on their second visit when they're established and see the doctor. Now, if that doesn't put the hairs up on the back of your neck, then nothing will. Needless to say, their laboratory was not meeting appropriate standards, and the hospital did not acquire that practice. I did report it to some of the managing partners at the CPA firm that this was something that needed to be reported. That was above my pay grade. I didn't feel comfortable doing that. But that doctor had somebody without a medical license practicing medicine and billing Medicare, Medicaid, TRICARE, Blue Cross Blue Shield, Aetna for services that were not performed by a doctor. If you do your due diligence, you're going to find those things out. And then do you really want a relationship with a company that's doing business like that? So I can't stress enough how important it is. Those things happen more often than you think. A lot of times, especially smaller organizations, have very effective ways of covering those things up. You need to know the right questions. You need to go in and ask very innocent and say, "Gee, tell me how do you do this or how do you do that?" How you go in and perform an audit and your demeanor is very important if you want to get people to lower their barriers, open up to you and tell you the truth. And that's a huge part of auditing and monitoring. So you can get, and part of the due diligence process as well. The DOJ states that effective implementation requires those charged with a compliance program's oversight to act with adequate authority and stature. As a threshold matter, prosecutors, they're going to evaluate how the compliance program is structured and address the sufficiency of the personnel and resources within the compliance function, as well as autonomy according to the size of your organization. Now, those are a lot of fancy words to go over something that we already talked about. Number one, you have to have autonomy. You can't be influenced. You can't be told, hey, you don't want to look over there at that department if you want to work here very much longer. That's not autonomy. The compliance function in larger, complex organizations may require you to have a compliance committee and the compliance officer having direct access to the board of directors. You need to make sure that you have an auditing team that can audit various types of functions within your organization that are qualified and to be monitoring as well and reporting to the corporate compliance officer how things are functioning and any areas of risk that are discovered or revealed. That costs money and you've got to fund it. A lot of times, what it's going to cost up front to do a good job of policing and monitoring for compliance is a drop in the bucket to what it's going to cost if you are found during an investigation to be guilty of fraud and abuse and you didn't do enough. Several new questions have been added with the latest ECCP revision under autonomy and resources. So, do the compliance personnel have knowledge of and means to access relative data? Is the company appropriately leveraging data analytics and the quality of its data sources? And are you measuring accuracy, precision, or recall of any data analytic models that you're using? If a compliance program did identify misconduct, including allowing for timely remediation and self-reporting, a prosecutor is going to view the occurrence as a strong indicator that the compliance program was working effectively. So that's going to weigh in your behalf. That's going to be a good sign. Prosecutors are going to review how your program has evolved over time, and if your organization conducted root cause analysis to understand contributing factors to underlying misconduct. They also are directed to assess how your organization promotes organizational culture to encourage ethical conduct and commitment to compliance with the law. So, if a prosecutor comes in, is there evidence of continued improvement, periodic testing, and review? And how often does your company measure the success and effectiveness of its compliance program? In conclusion, compliance with applicable laws, rules, and regulations, it's mandatory. It's not optional. Now, the OIG has a compliance guidance. It is optional for you to use that. It is optional for you to use the ECCP. Whatever you use is optional. Bottom line, you better be operating compliant. And the government offers these tools. The OIG offers the work plan. You just need to know where to go to look for it. You just need to subscribe to different listservs. Or subscribe to the American Institute. We kind of filter through and make sure our subscribers and members have important information. Healthcare organizations are highly regulated. And even though we're going to probably see in the next few years some deregulation, it's not likely going to be in the healthcare arena. We need to make sure that we are doing what we can to prevent fraud and abuse of our healthcare system and to improve the quality and accessibility of the delivery of care within our community. It is extremely important to develop a culture of compliance from the top down. When the C-suite executives and board members understand the importance of investing in compliance, it's going to allow compliance officers to have the resources to properly implement an effective program, audit, and monitor to ensure the program is working, and to quickly identify areas requiring improvement. There's so much to know, and rules are constantly being updated or changing. I'm hoping the information we covered today inspires you to integrate the ECCP as an additional piece of data to help you mitigate risk within your organization. And if you are new to compliance, the American Institute of Healthcare Compliance, we have a corporate compliance training program and online certification. We also offering auditing for compliance, which we recommend taking after you take the compliance officer training.